And so when we talk about impulse aggression, for example, and why serotonergic medications help, potentially maybe that's a facet of underlying anxiety, that the dog is always in this chronic anticipation of something bad happening and they lack inhibitory control. Then you have a dog that lashes out at everything. So that's my long-winded way of starting to dig into all of this.
No, it's a beautiful answer. It's not long-winded at all. I so appreciate it. What about sensory sensitivity? What about when a dog's Richter scale hits on routine or even novel sounds? I've noticed sometimes dogs, and it sounds almost similar to what you were talking about, a hypervigilance. However, the dog might be too tuned into, let's just say, for instance, sound sensitivity. And so they're constantly hearing every sound, dedicating their surveillance, and more or less in that anticipatory place of anxiety, and the odd sounds potentially sending them over further and further over threshold to the extent that a car door can shut and the dog will go into a display.
Yeah. Yeah. And noise reactivity and noise phobia are definitely things. And there is an FDA approved medication for thunderstorm phobia, for example, Cilio. It's an alpha 2 agonist and it's like microdosed. So it's a version of a common sedative that we use for dogs, but it's microdosed. So in theory, it only acts in the brain and doesn't produce physiological effects. And I have a lot of noise reactive dogs where we try Cilio and then try a desensitization counter conditioning session, and it's like markedly improved. Obviously, they're experiencing some kind of really intense emotional distress. And does the fear drive the anxiety, or is there an underlying personality trait of anxiety that heightens the fear and then it becomes this feedback cycle of anticipation? I'm not sure,